Hello and welcome everyone to our YouTube channel Shishu Care, and today we will discuss about this topic, how to choose a PG seat and whether to go for DNB or not. As you all know, NEET PG results are already out and everyone is planning to opt a seat as per their ranks, and it's a big dilemma for all the students in their medical career at this point of time, that which branch to choose and which college to choose. And once you opt a seat, and that is final for your lifetime, that you are going to become that particular specialist. So choose wisely and discuss with as many persons as possible that whether this branch is suitable for you or not, and this institute is suitable for you or not. And the other big important question for everyone is whether to choose DNB or not. So we will discuss about these points in today's short video. So DNB phobia, yes, it's a very prevalent disease in most of the medicos these days, that whether to go for DNB or not. And the three most important questions in everyone's mind before opting for DNB, that whether it is equivalent to MDMS or not, what is the passing rate in DNB exit exams, and whether proper training is provided at the DNB institutes or not. So about this equivalence, whether the DNB course is equal to the MD or MS degree. Yes, it's almost equal. With almost, I mean to say that if you are going to join any private institute, or you are going to start your own practice, then there is no difference between DNB and MD. You can just clear your exam and then start your practice, or join any good private corporate institute, and you are considered equal to your MD or MS fellows. But if you are planning to join the lecturership, or you want to become assistant professor in medical college, you want to join the academic stream, then there are few criterias which makes you equal to MD, and those criterias are easily available in a PDF format on NMC website or NetBoard website. The important points in those criterias, that the beds in which you are doing your DNB degree, that institute should be more than 500 bed, and there are few different criterias about the experience of your guide and everything. And if you are doing DNB from those institutes, then you are equal to your MD or MS counterparts. And even if you are not doing DNB, your institute is not of more than 500 beds, then also nothing to worry. The only difference is that before joining SR-ship, you have to, before joining AP ship, you have to complete your SR-ship for 1 year after doing MDMS. And if you are doing DNB from such institutes which are not equal to your MDMS institutes, then you have to do 2-year SR-ship. So only the difference is of 1 year, and that is not that much important. So this is the equivalence criteria. And next, about passing rate. Yeah, passing is definitely less as compared to your MDMS, but you can't directly say that it's less or not, because it depends on institute to institute. In some MD or MS institutes also, people are not passing the exams in the first attempt. But the thing is that day by day this DNB passing rate is increasing. Few years back the passing rate was very less. In few branches it was around 10 to 15%, but now you can see that the passing rate has increased, and it's almost 50 to 60% in those specialties where passing was very low, and in some specialties it's almost equivalent to 80 to 90%. So that phobia, you should be away from that phobia of DNB, that the passing rate is very low. It all depends on person to person, that how good you are preparing for the exams, and whether proper training is provided or not. So for this point, you have to inquire well, you have to personally visit the institute, and in many institutes the training is at par. And even in good corporate hospitals, the latest technology is there, especially in OT setups or ICU setups, and you get exposure to the recent technological advances also. So it's not like that training is not good in DNB. It's all better and even good as compared to some other institutes. So now a few points about DNB and MD, that what are the major differences. You can see these green sentences in green fonts are the positive points, and in red fonts are few negative points. So first negative point for DNB, the passing is quite difficult. But with difficult, I mean to say that the exam pattern is quite different here, and it's quite tough, because universal exam is there for all. At pan India level the theory exam is conducted, and you have to clear the theory exam, and then in next step you have to give, once you clear theory, then only you are allowed to give practicals. And in practicals the center is at some other institute at some other state, so no internal help is there, and you have to, it's just like playing cricket at a different foreign pitch, so you have to perform at the external institutes, so no internal support, and so the passing becomes a bit tough. And as compared to the MDMS, the passing is comparatively easy. Why easy? Because the examiners, the internal examiners are also there during your exam, your theory and practical. The result comes cumulative, but you have to pass in both theory and practical together. It's not like first you have to clear theory and then you have to give practical. You give both the exams simultaneously, and the main thing is that the exam is happening in your institute, parent institute only. So your HOD and your consultants knows you well, and they can assess you as per your performance in the previous 3 years and not just in that particular 3 hours of the exam. So the MDMS passing is quite easy as compared to DNB. The workload is moderate in DNB. It's not very much heavy in most of the cases, and in MDMS, in the medical colleges, in almost 80 to 90% of the institutes, workload is very heavy. So if you are ready to work hard 24/7, then you can join definitely MDMS. But if you think that there are some limitations and you are not that much in mood of joining such institutes where you have to work day and night, then you can go for few DNB institutes where the workload is moderate and proper duty hours are divided. And the good thing is there is uniformity in fee. The fee is around 1.25 lakhs per annum for DNB, and in MDMS fee differs from college to college, state to state. In some states fees is less, in some states it's more. Even it differs in government and private colleges. In some institutes fees is very much high. External center for exam, we have already discussed. In DNB you have to give your exam in some other centers. In some other states there are even language barriers sometimes, and you are provided with some translators. And in MDMS the exam happens in same institutes. About hands-on, it's we can't comment that in DNB or MD in which stream hands-on is better. It depends on different institutes and different departments. Even in a particular institute, various departments have different criterias and they provide different hands-on to their residents. So for this point you have to inquire that particular institute and then particular branch and seniors who have passed out from that institute. So you have to ask to them that whether, especially for surgical branches, that whether hands-on are provided or not. In non-surgical branches, this criteria is not of very much importance, because simple procedures in like medicine or pediatrics, simple procedures like lumbar puncture, intubation, they are being done by residents only in most of the places. But this hands-on point is very much important for the surgical branch people. And the thesis issue in DNB, the thesis is also quite tough because it's been checked by some externals, and many times they give again corrections. And it's not like MDMS where thesis is signed by internals only, or HOD or your guide signed the thesis and then it's final. But in DNB you have to submit thesis directly to NET board, and they forward your thesis to some external examiners and they check, and again sometimes they give corrections, so you have to correct your thesis 2 or 3 times. So thesis is quite tough in DNB as compared to MD or MS. So this is the broad difference between these two streams. And now how to choose college for MDMS and for DNB. Few points. For MDMS you have to look for whether the particular seat is recognized or not, or just permitted. And because in some places the seat is not properly recognized, then few guidelines are like that you cannot work in some other states after passing a degree from particular state, right? Like for example, if you have done MD from Gujarat in some college where the seat is not recognized, then you can practice in Gujarat only, and in other state it's quite difficult to practice. So you have to inquire about this on the NMC website, where the seat is recognized or not. You have to inquire about the fees. This is important points for many students, that how much is the fees for that particular college. Workload is very heavy or negligible. If negligible, then also it's of no value, and if it's very heavy, then also it's good for your learning, but sometimes even our health doesn't allow, then you have to keep in mind that point. Number of colleagues, it's very important point sometimes, because if only one seat is there in a department, then your life is going to be quite tough, and you don't have support of any colleague. Even during exams you can't discuss with anyone. So number of colleagues you have to keep in mind. It's not like that we can't join a department where only one seat is there, but yeah, if there are more than one, then it's good for you. Stipend is also important criteria for many students, because at this point of your life you need to earn also. Sometimes you have family responsibilities, so keep in mind about the stipend. Now for DNB, workload important point, because you should not join institute where no patient load is there. Moderate patient load should be there. Hands-on, as we have already discussed, is for surgical patients. It's important point whether hands-on are given or not. Even for non-surgical, you have to inquire that some decision making is in hands of the residents or not, or for even giving any antibiotic or any medicine, you have to inquire your consultants. So, and the number of colleagues, the same point for both MDMS and DNB, and stipend is important in every aspect. Now, the most important thing about choosing a branch is that field of interest should be your first priority. Keep in mind, field of interest should be your first priority. You should not do like, if you are highly interested in radiology and you are not getting MD radiology, you are getting DNB radiology, but you are killing your dream because you are suffering from DNB phobia. It's not like that. If you are die-hard fan of radiology or any other branch and you are not getting MD or MS in that branch, but you are getting DNB, then in my opinion you should go for DNB, because branch is very much important in your life. And as I have already told in the starting of this session, that once you choose a branch, and then for this life you are going to be that particular specialist only. So don't kill your dream. I would suggest that go for DNB if you are getting the particular branch in DNB and not in MD. Inquire about the college and branch thoroughly. You have sufficient time before starting of counseling, so inquire and visit personally to the institutes if possible. Once make a list about, like, suppose you are interested in 4 branches: radiology, medicine, pedia, gynae, and you have made list of these particular states that you can go in, particular states like Gujarat, Maharashtra, Rajasthan, and you are making a tentative list. And then as per your rank and as per the previous year's allotment, you can go through the previous year allotment, and then you decide that you can get seat in these first 10 colleges. So try to inquire those colleges where the probability of getting a seat is more. Even you can visit personally so that you get an idea about the infrastructure, hands-on and everything. Keep stipend in mind. Condition applied, as if your family condition is very well and you don't think that you need money, then it's fine. Otherwise, for most of the students at this point of their life, they need some money, so stipend is also to be kept in mind. Bond is very, very important these days. Most of our mind goes during counseling that whether bond is applied or not in that state and how much the bond is there. And the main thing is ki if you opt a particular state or particular institute where the bond is very heavy and it's not possible for you after completing your MD or MS, so keep in mind before joining only that whether you have to go to that particular state or not. And think about your future plans, for example family condition, that after 3 years where you have to settle, where you can settle in any other city or other state, or you have to go back to your hometown. And career of your spouse is also very much important, because you have to keep in mind that only suppose you are joining in PG this time and your spouse is currently in internship, and next year she is also going to appear for NEET PG, and then where you are joining, there any other seats is there or not of her interest. So you have to keep all those things in your mind also. And this point is important these days, is plan for super specialty. Now suppose you are highly interested in doing super specialty already, you have kept in your mind that I will do DM or MCH, then you can go for MD medicine or MS surgery. And suppose you are thinking that you can't do super specialty now and you have to just settle after this, then you can also go for some terminal branches like obstetric, gynecology or pediatrics, so that you can settle easily after completing your MD or MS. So these are important points which you should keep in mind before opting your branch. And I would again say that these were just my personal opinions as per my experiences so far, and conditions, opinions and decisions may vary from person to person, so it's up to you. The main thing, again, I would like to focus that the branch of your interest should be your first priority, and don't just kill your dreams on the basis of few phobias or few rumors about DNB or MDMS at a particular place. If you are in doubt, go to that place, visit that particular branch or institute or department, and you will get to know the reality. And if you are much worried about DNB, then ask your seniors or some students who have already passed DNB that it's not some rocket science, and you can easily do or clear those exams. So if you have any doubts related to counseling or especially related to DNB, so you can write in the comment box, and you can subscribe our YouTube channel for more such videos. Thank you very much, and all the best for your coming NEET PG counseling. Thank you.